Michael went into surgery. He was 22. He had just started nursing school, and he loved the medical field. Heavy manipulation of the brain. He went through 32 months of hell, and he was psychotic.
22-year-old Michael Skolnik became the victim of a completely unnecessary brain surgery. It started with a minor medical finding that quickly became a $4 million nightmare, trapping Michael and his family in 32 months of absolute hell. And it all began because a surgeon lied. At the time, Michael was working as an emergency medical technician while studying to become a pediatric nurse. At home, Michael was the center of his parents' lives. He was Patty and David Skolnik's only child and their best friend. Whether he was sailing out with his uncle or spending hours in the garage building cars with his father, Michael embraced life with an intense passion. In fact, those projects in the garage always made Patty joke that she had 2 children instead of 1. They remembered him as a compassionate person who always looked out for others.
I'd like to tell MedStar leaders and associates Michael's story so that this does not happen to other families. Michael was our heart. He was 22. He had just started nursing school, and he loved the medical field.
Just a wonderful guy. He was the type of child when he was in school that if there was a bully bullying somebody, even if he didn't know who the child was, he would make that go away. Just cared about people.
He was always very compassionate, and he took care of others.
He was funny, stubborn, and full of energy. But on September 17, 2001, for some reason, Michael briefly collapsed. He had been sitting on the couch with the family's new puppy when he suddenly passed out. This was actually the second time he had briefly lost consciousness within a 3-month window. However, a brain scan performed during the first episode back in July had come back completely normal, making this new blackout deeply confusing. Looking at the situation as an EMT and nursing student, Michael knew they needed answers immediately. So the family went straight to the hospital. A physician suggested Michael had experienced a seizure, likely caused by a bad reaction to Wellbutrin, a medicine he was using to quit smoking. To be safe, Michael's primary care physician ordered a CT scan to see if there was an underlying cause for his seizure. However, the scan did not give a clear answer. But the doctor spotted something unusual inside the third ventricle of Michael's brain. Based on this scan, he was admitted to a local hospital for observation, and a neurosurgeon was recommended to evaluate the finding. The scan picked up a tiny 3mm spot on his brain, possibly a colloid cyst. While these growths are non-cancerous, they only become dangerous if they block the brain's fluid and cause pressure to build up in the skull. But a cyst this small, it didn't require immediate surgery. To determine if the spot was actually blocking any fluid, an MRI was ordered to get a clearer picture of the brain. Based on those results, other physicians later informed the family that the small dot was likely harmless, backing up the idea that the smoking medication caused the collapse. In fact, a medical review conducted later confirmed there was absolutely no rush to operate on this finding. As Patty later recalled, there was no rush to go into that surgery. But we didn't know that then, and we didn't even know what to ask. But the next day, the specialist called Patty directly. He bypassed standard medical caution entirely, scaring the family to death by telling her that Michael needed to be in the ICU immediately, warning that he had to perform brain surgery within 48 hours or their son would die.
So the next day, I called this neurosurgeon. And the next thing I know, the doctor was on the phone. And he said he needs to be in the hospital for observation. You are so lucky he didn't die. And I said, excuse me. And he said, colloid cysts are terrible. The doctor that discovered them died from one himself. And he said, we'll call you, let you know what hospital to go to, which they did. And it was all happening very quickly. Not even enough time to kind of think this through.
Absolutely terrified. The doctor's telling me, my child's going to die. We're talking 48 hours, 72 hours. He's actually just scaring the death out of us.
While the threat was severe, the specialist made the actual operation sound simple, claiming Michael would be out of the hospital in less than a week. He painted a picture of a flawless, minimally invasive procedure, promising them he would use microscopically pinpoint accuracy to just slide between the lobes of the brain, grab the cyst, and cleanly extract it.
But the way he explained it to us was was no big deal. He'll be out of the hospital in 6 days. It's not a big deal. This guy's done hundreds of these. He said,
Microscopically, pinpoint accuracy, just open the lobes. It was right there, and we'll just extract it. We were so scared to death. We weren't watching what was going on, you know. You're involved in it so heavily, you can't think properly.
Since he was the expert, the family believed him. Before the main operation could take place, the specialist stated he needed to place a ventricular drain to relieve pressure on Michael's brain. What stunned Patty and David was not just the procedure, but where it happened. Instead of utilizing an operation room, the specialist performed it right in Michael's hospital room using a hand drill. The neurosurgeon presented this bedside procedure as entirely risk-free, so Michael and his parents agreed to it.
get to the hospital, have another CT, go up to the floor, and the doctor comes in a couple of hours later, introduces himself, tells us where he's from, and holds up the CT, shows it to David and I, and says he needs to, his ventricles are enlarged, there's fluid there, it's blocking, he needs to have a drain put in right away to reduce the pressure in his brain, and then he's going to have surgery within 48 hours. Brain surgery.
While the specialist was inside with Michael, the family waited out in the hallway. When the nurse finally emerged from the room, she revealed that Michael had received too much medication and stopped breathing during the procedure. To show them exactly what had occurred, she handed Patty the breathing tube the team had just used on her son. Armed with this knowledge, David later asked the neurosurgeon directly if Michael had stopped breathing. Instead of answering, the doctor immediately became defensive. Terrified by this response, the family desperately sought a second opinion from their regular primary care physician. Their doctor had original plans to elevate Michael safely for a basic seizure disorder and was actively coordinating a referral to a neurologist. The next morning, the doctor sent a fax explicitly warning them to hold off the operation, explaining that the tiny spot on the scan was likely harmless and did not require major surgery. But when the family confronted the neurosurgeon with a fax, he completely dismissed the warning, demanding to know why they would trust a regular doctor over a specialist. He completely flipped the narrative, convincing Patty that the emergency room staff had completely missed the danger and that he was swooping in to save their son's life.
So at that point, I know I was feeling so grateful because they obviously missed this in the ER because he's the neurosurgeon and he was saving our child's life.
To ensure the surgery moved forward, the neurosurgeon bypassed the parents entirely. The very next evening, while Michael was under the influence of heavy pain medication from the hand drill procedure, the neurosurgeon entered the room and had him sign the paperwork for the upcoming brain surgery without his parents' consent. A later medical review by physicians who examined the case found that Michael had given his consent for brain surgery while on medications that severely impaired his understanding. Reviewers also pointed out that the family was never given the choice to just skip the operation. The real dangers were never discussed and their questions were pushed aside. The surgery was set for Friday, and it was supposed to take about 3 hours. The family went in believing the specialist would simply make a small cut through the skull to remove the cyst, and that Michael would spend less than a week recovering from what was described as a total walk in the park. But 3 hours passed and Michael did not return. As the minutes bled into hours, the silence from the operating room grew deafening. The surgery stretched past 6.5 hours before the doors finally opened. When the specialist emerged, he did not deliver the news the family expected. He knelt down on one knee, pushed his surgical cap back, and openly complained about his own life, telling the terrified parents that this had been the worst year of his life. When they asked how Michael was doing, the surgeon admitted that he could not find the cyst at all. To explain it away, he offered a clumsy excuse, guessing that he might have accidentally punctured and deflated the cyst earlier when he drilled the drainage tube into Michael's room. Rather than removing the growth, he had spent hours performing heavy manipulation of Michael's brain, warning the parents that his recovery might be far more difficult because of it.
Michael went into surgery for his 3.5-hour surgery, and 6.5 hours later, the doctor came in and he kneeled down on one knee and he pushed his hat back and he said, "This has been the worst year of my life." And we said, "How's Michael?" And he said, "Well, I went in and I didn't find the cyst, but I did heavy manipulation of the brain." And he said, "I never found the cyst." Said, "I found a little bit of some matter, and I'm thinking maybe I punctured it when I went in with the drain, and so I sent that to pathology. But actually finding the cyst intact, I didn't do."
When Patty and David were finally allowed into the intensive care unit, the scene looked nothing like the minor procedure they expected. Michael was hooked up to machines, his head was wrapped tightly in heavy layers of medical gauze, leaving his parents completely unprepared for what they were looking at.
And he said, "I never found the cyst." Said, "I found a little bit of some matter, and I'm thinking maybe I punctured it when I went in with the drain, and so I sent that to pathology. But actually finding the cyst intact, I didn't do."
Because the thick bandages hid the shape of his skull, they still assumed the specialist had kept his word about a small incision. The reality of the operation only came to light on Sunday morning, when a covering physician arrived to check on his progress.
The doctor that had been on call was unwrapping Michael's head. Suddenly, we saw Michael had had a craniotomy. We were both in disbelief. Neither one of us said a thing to the other for, I think, probably almost 12 hours, because I think we were both thinking, how did I miss that?
The sight left Patty and David frozen by the bedside. They had gone into Friday believing the procedure was a straightforward walk in the park, only to discover that large portions of their son's skull had been entirely removed without their knowledge or consent. The heavy trauma to his brain immediately triggered a severe medical nightmare. Michael was left 50% blind, paralyzed on one side of his body, and completely stripped of his short-term memory. He suffered from a severe seizure disorder, constant intense pain, and psychosis.
Michael was 50% blind. He was hemiplegic. He had no short-term memory. He had severe seizure disorder. He had the thalamic pain syndrome. And he was psychotic.
By Monday, Michael's condition deteriorated rapidly. His eyes began bulging as fluid pressure built up inside his skull, forcing doctors to insert the first of what would eventually become 6 separate cranial drains. Not long after that, Michael suffered a severe seizure as his brain struggled to cope with the immense pressure. To make matters worse, when a pathology report came back on the brain tissue the surgeon had actually removed during the operation, Patty learned the tissue was completely normal. This unnecessary operation initiated a 32-month medical ordeal that systematically broke Michael's body down, completely stealing his ability to speak and leaving his physical health entirely destroyed. His physical body began to collapse under successive waves of severe trauma. He suffered from repeated bleeding in the brain, MRSA infections of the skull, deep vein thrombosis, and a pulmonary embolism that left him dependent on a ventilator and a feeding tube. Following the initial brain surgery, his medical crises multiplied. He spent 5 agonizing months in intensive care before being transferred to a specialized brain injury rehabilitation facility. The active young man who once trained to save lives was gone. Michael was now dependent on a respirator and unable to walk. The damage to his pituitary gland even caused his metabolism to fail, forcing his body to gain 100 pounds. He required constant care, breathing through machines and receiving all of his nutrition through a stomach tube. 4 months into his stay at the rehabilitation facility, doctors told the family they couldn't help Michael anymore. Refusing to give up, Patty and David rented a motorhome, converted it into a mobile intensive care unit, and drove 27 hours to a specialized neuroskills center in Bakersfield, California. For 8 months, the center became their last hope. While trying to maintain their jobs back home, Patty and David spent every other weekend traveling to California. By January 2003, Michael was finally discharged. He could only take a few halting steps and speak a few words, but his parents brought him back to Colorado. They converted the dining room of their townhouse into a permanent ICU, managing his complex medical needs around the clock. He remained stable for just 6 weeks before this crisis returned. The remaining 18 months of Michael's life became an exhausting cycle of multiple organ failures, severe systemic infections, and emergency hospitalizations. His body was stuck in a constant state of collapse, all stemming from the trauma of that single, unnecessary procedure. When what was left of his health completely crumbled, the doctors presented the family with a devastating choice. Because Michael was conscious but unable to speak, David and Patty had to ask him to make the final decision by squeezing their hand.
Doctors presented the choices to Dave and Patty. They took the options to Michael. He was conscious but unable to speak.
We said, you have two choices. We can let you die comfortably, or we can put you back on life supports, and you have to tell us what to do. And you squeeze our hand. One is this, two is the other. And each time he squeezed our hand, we did it for a 24-hour period, squeezed our hand to let me die.
On June 4, 2004, after 32 months of a relentless medical nightmare, Michael's body could no longer hold on. He was only 25 years old. In his final moments, he looked directly into his father's eyes, mouthed the words, "I love you," and passed away.
He opened his eyes and he mouthed, "I love you." His dad was sitting at his head and he died. And it was like, this all shouldn't have happened.
She says a botched surgery on Michael's head began an excruciating 3-year, $4.5 million medical nightmare that left the family shattered.
4 years ago, he went through 32 months of hell.
David was left looking back at photos, trying to process the loss of his only child, who had been his closest
I
companion.
look at these pictures and I just can't believe my boy's gone. We did everything together. He was my friend and my son.
Years later, David is still caught off guard by sudden reminders of his son around the house, like stepping out into the garage and unexpectedly finding Michael's old work boots and flight jacket left behind.
I really do miss him. It's been a long time and I still miss, I go in the garage, I found his boots yesterday and fly the jacket. But he was a fantastic person. I mean, I was really surprised that we created something that was so unique. And he just wasn't a kid. He was more than that. He had special qualities to him.
Following Michael's passing, a lawsuit began to uncover the agonizing reality of what actually happened inside the hospital. During the initial consultation, the specialist had claimed he performed this exact, delicate operation numerous times, but when questioned under oath, he admitted that Michael's complex procedure was actually only the second time he had ever performed it.
There was somebody who decided that he was competent to do this operation of so many he told us he did. In the end, we found out he had only done one.
The family believed his relaxed attitude meant he had years of experience. They were never informed that their son was only the surgeon's second patient for this specific operation. Worse yet, medical papers published 2 years before this case showed that a far safer option already existed. Instead of open brain surgery, doctors were using a tiny camera called a rigid endoscope to cleanly remove these cysts. Studies showed it took less time, got patients out of the hospital faster, and carried almost zero permanent risks. But because this surgeon didn't know how to use the equipment, he kept Patty and David completely in the dark, denying them a safer choice that could have changed everything. The surgeon's lack of experience was only the first piece of information the family had been locked out of knowing. Patty had actually researched the neurosurgeon through the state medical licensing board before the operation, finding a completely clean board. What she did not know was that the system back then hid a doctor's past if it happened in another state. The family discovered too late that this doctor had a history of malpractice lawsuits and wrong diagnoses before moving to their state. If the public system had simply shown his full background, the family would have immediately looked for another doctor. This complete lack of information became the main reason the family decided to take action. Patty realized the situation was made worse because the hospital system intentionally kept families in the dark right when they needed the facts the most. Even after the legal battles, the specialist faced no immediate automatic medical board removal. He later moved to Nebraska to join a practice at Western Plains Neurosurgery before eventually returning to the Denver area. In fact, official medical profiles still display no public board disciplinary actions against his license. But while Patty and David could not save their son from a tragic, unnecessary procedure, their refusal to stay silent ensured that millions of other families would finally have the power to look up the truth before it was too late. To honor a promise she made to her son, Patty turned her grief into systemic action. In 2005, 1 year after his passing, she founded Citizens for Patient Safety. She walked away from her career to dedicate her life to a single goal: ensuring no other family would ever be blindsided by a lack of medical transparency. Patty took Michael's story directly into medical school classrooms, hospital boardrooms, and public meetings. She began teaching future doctors that getting a patient's permission for surgery is supposed to mean discussing the risks, benefits, and choices instead of just a thoughtless paper signed under heavy pressure. Her work completely changed local laws, prompting an in-depth look at how much patients have a right to know.
It was a medical nightmare that led to a new law here in Colorado.
Next month, all doctors will have to register any problems from their past with state regulators.
Would want to know if there were problems in our doctor's past, like making mistakes that caused someone their life. That's exactly what led one woman to lead the fight for Colorado's medical transparency law.
In 2007, Colorado passed the original Michael Skolnik Medical Transparency Act, forcing all doctors to fill out public profiles. The new system required public reporting of specific background data, including any disciplinary actions, malpractice, judgments, settlements, or arbitrations.
Skolnik says if she'd known the surgeon had a malpractice claim against him in Georgia, they'd never have used him.
I lost my son due to medical error.
So 3 years ago, she began fighting for the Michael Skolnik Medical Transparency Act. The site will give you specific information about a doctor's background, any disciplinary actions, malpractice judgments, settlements, or arbitrations against them.
While families welcomed the data, the new requirements faced pushback from the medical community. Some practicing doctors explained that the rules were unfair and too demanding of their time and finances.
The honest answer is I think it's an experiment.
Cardiologist Randy Marsh was at first resistant to the idea.
I think we don't know enough to know if this kind of disclosure, widely available, will truly make a difference. The other question is it worth trying? And the answer is yes.
It also requires reporting of any outside business or possible conflicts of interest.
To educate people so that they don't make the same mistakes I did.
But doctors have complained the requirements are onerous and unfair and will cost them time and money.
Despite the complaints from the medical field, Patty remained firm that public safety required full disclosure. For her, the human cost of keeping medical errors secret was far too high.
But Patty says the last moments of her son's life convinced her everyone should know about a doctor's mistakes.
You put lack of quality, unsafe systems in a bad environment, and you come out with a dead child.
Even though the law states that a financial settlement does not automatically mean a doctor admits to a mistake, it finally gave families the facts they needed to protect themselves. This new law could never fix that unnecessary surgery or erase the 32 months of hell Michael went through. But it broke the culture of silence that had protected dangerous doctors for decades, ensuring no other family would have to walk blindly into an operating room ever again. In my opinion, this should not be limited to one state. Every patient in every country should be able to see a doctor's real professional record before a life-changing procedure, or supposedly just a small one. Let me know what you think in the comments below and subscribe. See you in the next one.